Hello and welcome today to the topic of OSA and TMJ. I am Dr. Tofiqbohra and I am an oral maxillofacial surgeon specializing in TMJ disorders. OSA stands for obstructive sleep apnea, which is a sleep disorder characterized by repeated episodes of complete and partial obstruction of the upper airway during sleep. This obstruction can lead to decrease in the amount of oxygen in the blood, which can cause various health problems. The common symptoms of obstructive sleep apnea include loud snoring, interrupted breathing during the sleep, gasping or choking for air during sleep. It may lead to daytime somnolence, which is daytime sleepiness, morning headaches, and difficulty in concentration or staying alert during the day at work. OSA can be caused by various factors, including obesity, anatomical abnormalities in the upper airway, any underlying medical conditions such as heart disease, hypothyroidism. Treatment of obstructive sleep apnea typically involves lifestyle modifications such as weight loss, uh, avoiding alcohol before bedtime, as well as the use of a device called as CPAP, which is continuous positive airway pressure. This machine helps in keeping the airway open during sleep. TMJ disorders can also cause obstructive sleep apnea, and hence we are making this video that a patient with obstructive sleep apnea may have TMJ disorders, or a patient with TMJ disorders may have OSA. However, the likeliness of the latter is very rare. TMJ is the only bone which is the only joint which is responsible for connecting your lower jaw to the cranium, and it is surrounded by muscles that control the jaw movement. Now, what happens is changes in this position of the jaw and the tongue muscles can cause narrowing of the upper airway and in return lead to snoring, gasping for air, and subsequently obstructive sleep apnea. So, TMJ disorders can also cause pain, discomfort in the head and neck region and can interfere with the sleep quality and exaggerate an obstructive sleep apnea condition. People with TMJ disorders may also be more likely to clench and grind their teeth during sleep, which can further lead to upper airway dysfunction and obstructive sleep apnea. An OSA patient typically protrudes his jaw forwards in order to maintain the breathing. That can lead to an excessive load on the disc and cause a displaced disc. Overall, it is clear that by addressing TMJ disorders can be an important part in the treatment and the management of obstructive sleep apnea. However, combination of lifestyle and the machines, devices such as CPAP are always better and useful in such problems. However, one can also use dental repositioning splints, which alter the position of the jaw and help the patient in obstructive sleep apnea. In my experience, patients with OSA and TMJ, temporomandibular joint disorders, obstructive sleep apnea should be treated first because TMJ per se as a joint has a higher remodeling capacity and can adapt to the new changes, if at all any. Thank you for listening to the video. And if you have any doubts regarding obstructive sleep apnea or TMJ or both, please feel free to contact at the given numbers. Thank you.